Hi, I'm Dr. David Tenner, and we're here at the Goldberg Clinic for chronic disease reversal. And we're here today with Miss Lisa Chandler. And Lisa's from Acworth in Georgia, and she came to see us back in August of 2013. Today she's been kind enough to join us and share her story with you, our audience. She's going to share a little bit about her experience with Dr. Goldberg and myself. And so Lisa, why don't you tell us a little bit about what brought you in to see us back in August?
Okay, well, it was ongoing medical issues. My major concern was diabetes. I had been going through medical, I went the traditional medicine route and got metformin and some other drugs to try and bring my glucose levels down, but they didn't work over a course of 4 years, maybe a little more, and had high blood pressure and just got concerned that my kidneys were going to be damaged from all from the glucose levels being so high, and the medications that I was on, I wasn't able to get them, even with medication, below 250. And so that's what prompted my call to you and Dr. Goldberg. And since seeing them, that has all changed with no medication. Just getting my lifestyle right and learning how to eat, learning that how important sleep and sun is to overall health, and I feel better. I've started to do things that I wasn't able to do years ago, like wear heels. I wasn't able to because of all the extra weight that I was carrying around. Just caused a lot of pressure on my feet, and even that in itself to me is a big deal because I love heels. I feel so much better. I have more energy, and people notice. They just come up to me and they want to know what I'm doing, and I just tell them about Dr. Goldberg and Dr. Tenner, who have changed my life because I'm not the person I used to be. And obviously, am I talking too much?
You're fine.
I could go on and on. I really could.
Well, I'm just going to interject there, and I remember when you called in originally, back in, I think maybe it was late July of last year, and I remember the call because I was the one that spoke to you. And at the time, Lisa, I could sense a lot of anxiety in your voice, and understandably so, because you had been diagnosed with diabetes, and diabetes is a significant issue in and of itself. But it also comes with a number of secondary complications. And so I know Lisa was very concerned about some of those secondary issues that could arise as a result of unchecked blood sugar, such as heart disease, diabetic neuropathy, blindness, cataracts. The risk of just about every chronic illness goes up when the blood sugar goes unchecked. And just about 1 in 4 in our population, about 25% of people in America are diagnosed with diabetes. So it's become a huge problem in our population. And that doesn't even include all the people who are pre-diabetic. So these are some of the general issues that are associated with this problem, and understandably so, the reasons why you were concerned about your health when you first called in. And so we had Lisa in, as we do with all of our patients. We sat down for a good long time, and we did a thorough workup and got to know her case on an individualized basis, and started to implement some steps to rebuild your health and function so that your body could naturally regulate its own sugar. And when you first came in, your blood sugar was what?
It was 252 on medication.
252 on medication. And so for our audience, actually a normal blood sugar reading is actually somewhere between 60 and 90. And so your reading was more than almost 3 times the normal upper limit.
Yeah.
And that was while taking medication.
Yeah.
Metformin, is that right?
Uh-huh.
Right, okay. So medically, the interventions that they were recommending really weren't working.
No.
Okay. And how long was it, while you were on a program with us, how long was it before you started seeing some improvement in that regard?
Oh, I started seeing improvement immediately. The glucose levels started to drop after that first week, and it has been since August of last year, and they have been consistently down.
Down?
Yes.
And I think today you told me that your glucose levels have on average been somewhere between in the 80s to the 110s, which is now at the upper limit of normal, a far cry from where they were before, 252 while on medication.
Yep.
Right, and so we've seen some pretty significant improvements in that regard. Okay, so not only are you feeling better, but you've also noticed some changes physically as a side effect of getting healthy. You've lost, from our calculations today, your re-exam about 16 pounds. And just remind us, what did the guy outside say to you on the way in today?
I love it. He said, "You look great in those skinny jeans."
Look at that. All right, so that's a real change right there and something we can be proud of. And now as we're moving into the summer season, beach season, bathing suit season, Lisa will be able to show off her all these improvements that she's had, which is very exciting. So.